Have your clients asked what they need to do to prepare for giving birth in the hospital? Do they know that they can advocate for themselves? How do you suggest they prepare for birth? In today's episode, I talk with Kelly Hof, a labor and delivery nurse and birth coach, on how to best prepare and support our clients who are having a hospital birth. Hello, friends. This is Lynn Schulte, and you are listening to the Birth Healing Summit podcast. We are here for meaningful conversations that will transform the way you work with pregnant and postpartum clients. Whether it is a new perspective, tool, or technique, you'll be able to implement it into your practice today. I invite you to sit back, listen with an open mind, and grab the golden nugget today's guest has to offer. Now let's get started. Hello, everybody, and welcome to this episode. Today I have with us Kelly Hof. Kelly is a labor nurse, a birth coach, and a podcast host as well, and a mother of two. And Kelly actually had me on her podcast, and we had such a fun time and great conversation. And I loved what Kelly was sharing in that interview. I'm like, I want to have you on my summit or my podcast so that you can share your unique, I think it's unique approach to how you work with women in the hospital giving birth. So welcome to the podcast, Kelly. Thank you for being here.
Thank you so much for having me. I
Yes,
really enjoyed our episode on my show, so
yes. And
it's
you're
great to be able to
let's
extend the conversation.
yeah. So birth, remind me of your podcast. Tell us about your
The
podcast name.
Birth Journeys podcast. Yeah. So it started off as just wanting to share all the different experiences in labor. As a labor nurse, I've seen so many different options. And I feel like the biggest downfall of new moms is to come in with all these expectations and then have feelings about their performance in the birth
Mm,
after the fact and feeling like things didn't go the way that they had planned and that that's somehow a failure. And as labor nurses, we always say, um, if mom and baby are healthy, then we have won the lottery, essentially.
yeah.
But that doesn't necessarily translate into emotional health. And so how do we bridge that gap? And so my thought at first was to start sharing birth stories so that pregnant people could learn what they might be able to expect, especially if things come up like a diagnosis that makes the birth that they had hoped for
Wow.
impossible. And so hopefully just healing through sharing and eliminating or decreasing the incidence of trauma by understanding what could happen. But it's also morphed into sharing a lot of educational aspects of birth. I've had physicians on, I've had psychiatrists, therapists, pelvic floor physical therapists,
Yeah.
all sorts of people on sharing how they help contribute to birth and healing.
Awesome. That is so, so needed. And so thank you for what you're doing with that. And so I'm curious, when we were talking for my interview on your podcast, you were sharing about how you approach a new patient in your care who is laboring. And so would you share with us um how you approach a new client that you're working with in the hospital?
Yeah, so it kind of depends on the situation, but for the most part, my hope is to kind of let labor progress. And how does that happen? By not freaking out the mom. So, so
Yeah.
how does what I mean, when we were talking, I was talking about the vulnerability and just the physicality and the need to release all your inhibitions to be able to properly birth. And how does one do that when there's a labor nurse or physician or food services person coming into your room every 30 minutes? So again, depending on the type of labor, like if you're laboring and you are coming in with a natural birth and you're about to, pop out your baby, yeah, I'm gonna hang out. I'm gonna be there. Like, okay, here are my hands. I'm gonna be here in case the physician doesn't get here. But if we're starting an induction, there's a lot of things that are going to be happening. Like we're going to be starting an IV, we're going to be starting probably some cervical ripening. Um, and the hands-off approach, making sure mom and baby are okay, clustering the care so that when I go in, I'm doing all the things that I need to do and I'm getting out. keeping the room quiet and dim and keeping um, just everything low stress is how I prefer to practice. I don't wanna come in just to, like, chart or, do piddly things in the room. That's not my hope. I try to set up my room so that the patient can labor in there comfortably, like that's their own room. There's a big push right now to labor at home or labor in a birth center because of that feel, and we don't really do a good job of providing that in the hospital. And so I try to, I mean, in the hospital, most of the time we have continuous monitoring, so I can see what's going on with you and your baby. So I only enter the room when they're like clustering care. There's a treatment that needs to be done. There's an assessment that needs to be done. There's a position change or something that can only be done at the bedside. And then as I'm in there, like you were saying, I read the room. I try to see if they desire more support or if they just desire quiet. And I ask if I can get them anything or, is there anything else I can do for you? Kind of, like your waiter or your waitress
Yeah.
might do,
Yeah. Well,
because
go ahead.
you don't want to bother. And like if you're at a restaurant, right? Your waiter or your waitress, if they're talking to you too much, you're gonna be like, dude, like what
Give us some space.
we're not here for you, right? Yeah, we're
Yeah.
hanging out. We're doing like the thing, right? And so
Yeah.
I try to let people do their birthing thing.
That's awesome. Well, I just hadn't really heard of a labor nurse. I mean, especially from the stories I hear from my clients, and
Mhm.
it is more intrusive. They're coming in and coming
Mhm.
out and going. And one of the things that I work a lot with my clients is especially when they've had a nurse that they're just not vibing with, or the nurse's
Yeah.
energy is just not conducive to a relaxed labor and delivery. And so, from your experience, like, can you share with our audience, like, what is a person's right? So I don't know if this has happened to you, or, if someone comes in and is like, I do not like this nurse. She is not vibing with me. I do not like her
Mhm.
energy. Is there a way for them to get a new nurse? Like, how do you make that happen?
Yeah, there is. I mean, I'm gonna be completely transparent. I've been fired. Like I've had patients say, "You're not vibing with my energy." Okay, cool. That's fine.
Yeah.
Sometimes that hands-off approach, every once in a
You don't
while,
like that.
people are like, "No, like that doesn't work
We
for
want you
me."
right here.
Right. And I'm like, "Okay, cool." Um, it is possible to say, "I'm not feeling it with this nurse," or something about this nurse. And who knows? It might just be like she looks like that girl that bullied you in high school.
Right.
You
Yes.
know?
Yeah.
You know, and when you are in that space, um, all of your all of your feelings and like past traumas and all of this stuff is going to come up for you.
Yeah.
You're in such a vulnerable space and it's such a requirement for you to really let go and release your inhibitions. It's hard to do it if someone's triggering you. Even
Right.
if it's just because like her green eyes look like the green eyes of the person that fought you in high school or whatever. It may have nothing to do with that person. So if you're feeling uncomfortable with the person taking care of you, it is completely within your right to say, I don't feel comfortable. You would talk to the charge nurse.
Okay.
That person can help you figure out what the best approach is. There isn't always another staff member available. Um, and to the best of your ability, I recommend that you do it in the most judicial way possible. You-
Yes. 'Cause that could be a
because
long rest
especially
of that shift if you're stuck with
right,
the person. Yeah.
exactly.
Yes.
Um, I if someone's mistreating you 100%, yes, report that.
Right.
And also, don't shame yourself if there is just something that isn't working with that
Yeah.
energy.
Right.
You can say something
Well
without it being an issue.
well, I think what everybody needs to understand is that the energy of that birthing person
Mhm.
is expanding during that
Mm,
birth process.
yeah.
And it expands and fills the room.
Mhm.
And that's what needs to happen to allow this baby to come through. In that happening, though, their sensitivity is increased a thousandfold.
Yes. Yes, I could not have said it better myself. If I'm the person that comes in and pops that bubble every 30 minutes, we are never going to have a spontaneous vaginal delivery. It's not going to happen.
Yes.
Or
Yeah.
even an induced vaginal delivery, you know?
Right.
You have to be able to let that physiology happen.
So important. So important. So, what are some of the things that you've experienced in your being a labor nurse that you have found helpful to your clients and to the progression of a labor when things maybe aren't flowing?
Well, so it depends on where we are in the labor process and what interventions have been done. If we have a mom that's laboring naturally, I try to encourage her to move in a way that takes, so a lot of things, let me back it up. Most moms have had the experience of the sensations that happen with uterine contractions alone, right? That tightness, that crampiness, all of that is something that we've all experienced because we've been practicing, our uterus has been practicing for labor every month when we have our period, right? Um, what tends to throw moms off is that pressure. When
Mm,
that baby starts moving through your pelvis and expanding the pelvis and pressing on the bones of the pelvis, that is the part that most moms are that start to feel uncomfortable and start to consider pathological or scary. So what I usually say is if you start feeling that pressure, you're going to start moving your body to relieve the pressure. So the biggest for me, the biggest shock during the birthing process was the feeling, and I kind of liken it, if you've ever got stubbed your toe or had some
oh,
heavy object run over your toe,
yeah.
and your instinct is to pull away from it.
Yes.
When you're pulling away from it in labor, your pelvic floor is tightening,
Yeah.
right?
Yeah.
We're not doing the right thing. So instead of using your pelvic floor to pull away from it, you move your body to relieve the pressure. Because if the pressure is in that one spot and it's a bone and it's your baby's head on a bone, it's not coming through right. So
Right.
you need to keep moving. So we're just going to keep moving away from that pressure, not sucking up the baby with your pelvic floor, but moving that pressure. So whether it's the birthing ball in one of the hospitals I work at, we have wonderful rocking chairs, which I think are just the most amazing thing ever. You can change the angle of your pelvis in them. You can put your feet up, rock back and forth, you know, side
Yeah.
to side. If you're in the bed because you're tired, I can move you, you can move you. There's a lot of things that we can do. If we have an epidural, the pelvic floor is usually relaxed, and that's not necessarily the problem. What I'll look for is your baby's response to the labor process, or if you're on one side and your epidural starts to wear off and you start to notice pain in a certain area, we're going to try to move away from that so that we're not constantly having that pressure in the same spot, because the idea is to move your baby down in the pelvis. And that's the idea of spinning babies, along with the balancing and the working with the soft tissue to relax the muscles and ligaments and all the soft tissue of the pelvis.
Yeah.
But my biggest thing is to just kind of move, not move with the pain, but not into it.
Got it.
Kind of just,
Yeah.
not have the pressure be constant in one spot.
Got it. What is the percentage? Like, how big of a hospital are you in? Like, how many births do you guys do a month? And then,
Oh, I should have looked up the statistics.
oh, that's all right. I mean, like, are we talking several hundred? Are we talking 50?
uh at least several hundred. I feel like we do like, oh gosh, 1,000.
Oh,
Why am
wow.
I thinking 1,000? It's a lot. So
Right. So,
typical day, 5 or 6.
okay, that you're helping, or no, that the whole unit's doing? The whole
That the
unit?
whole unit's doing.
Okay. All right. So then, of those, how many are epidural versus natural?
Like 90%.
90% are
Hmm.
okay.
If
So
they're if 90%, like I would say 90% of the vaginal deliveries, which is I feel like close to the national average, like in a hospital birth. And an
yeah,
out of hospital birth, that's completely different.
right.
Um,
I
But
was
usually the ones that don't have an epidural are the ones that just come in spontaneous labor.
okay. And they're too far along to get one maybe,
Or
or
they didn't want
they
one.
don't want
Yeah.
one. Okay. All
Mhm.
right. Yeah. I was surprised when I gave birth. There was probably 10 rooms and 10 people laboring, and everybody's names were on the wall, and I saw epi, 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 and I was the only one that had Nat by my name. So I was one of
Nice.
10 in
Yeah.
that area. And I was just like, oh, that's interesting. To me, I was more afraid of the epidural going into my spine than of the labor process and the pain of the
Mhm.
labor. So that's why I didn't want to get an epidural.
Mhm.
So that's my choice. But what I love that your whole staff is trained in spinning babies. How beautiful
Yeah.
is that? For
Yeah, it may not be the whole staff now. It was the whole staff about a year ago.
okay.
Or
Yeah.
maybe half the staff about a year ago. It was offered and then there was like limited spots, but those that aren't will come to the ones that are and say, help me.
What do I do here now?
Yes.
Right? Yeah.
Yeah, it's game changing when you are able to visualize the baby coming through the pelvis and the articulation of the pelvic bones and how we can work with that.
Yeah.
I think it's amazing, and I think it has really our goal was to decrease our C-sections, and it actually did.
Awesome.
Yeah.
Awesome. That is so great to hear.
Hmm.
So Kelly, tell us, remember in my interview on your
Hmm.
podcast, you were talking about the sacrum. So tell me
Yes.
your experience. What do you see in birth happening to the sacrum?
Well, there's two things. So I pay attention to where the baby's head is in the pelvis and position the mom based on that.
Yeah.
So like you know how the sacrum is okay, so if you're sitting with your knees out, then your sacrum is tilted, like your tailbone is tilted
Extension.
under.
Yeah.
Uh-huh.
Into
And so that's when we're like -3 to like zero station, right? And so
yeah.
this is the baby's head. Your sacrum is your
So you're
tailbone will catch the baby's head, right? But once
yes.
the baby's head is caught, like cradled in the tailbone, we need to close those knees so that we do the opposite.
Yes.
And then the baby's head comes down, but you can see that. You
Yes.
can see their butt change. It goes from like a normal looking butt where like your butt crack goes down
Uh-huh.
to it tilts up and you've got this lump that goes down into your butt crack. And then like you got your butt cheeks. So it's like this
Yeah.
is what it looks like. And it gets I've noticed it gets stuck that way sometimes. So after the
Surprise
baby,
everybody.
right. If your butt looks different after delivery, you might want to get your sacrum checked out.
Yes. And so
I just
Kelly
it's
was
just an
asking,
incidental
yeah.
finding.
Yeah. Well, and that's what I'm finding in the clinic as well. It's like, oh,
Okay.
it doesn't go away is what Kelly's noticing after birth.
Right. So dads or partners, um, if you know, those lovely hospital gowns that open in the back, when
Yeah.
mama's walking around with her butt hanging out, if you see that sacrum and it looks different, if you see like a lump above the butt crack, go talk to a pelvic floor physical therapist that is trained in putting the sacrum back where it belongs.
Yeah. That would be someone who studied with me. So
Yeah.
the directory. I love that you are seeing the difference
Mhm.
and that it doesn't always go back. And that is what I'm finding in the clinic all the time. And sacral flexion is one of the most common yet hidden patterns that the pelvis gets stuck in after birth. And so I just absolutely love that you brought that up in my interview. And I'm like, oh my
Yeah.
God, there it is. There it is. Oh my
You
God.
got there's so many things that you brought up that I was like, oh my gosh, light bulb. Like we do all of that pushing on our side, and it was like, why didn't I realize that that locks I mean, of course I knew it would lock the pelvis, you know, the pelvic bones on the side that it's on, but then to think that it actually causes that unequal pelvic splaying, that fascinates me.
Yeah. And so a lot of times women will complain about not being able to sit evenly after
Hmm.
birth, like they feel
Hmm.
cattywampus when they're sitting, and that could be from that ischial splay, depending
Hmm.
on the position they were in when the baby came out. So,
Yeah, that's so amazing. I think all labor nurses need to know that.
yes, well, I think all birth professionals need to understand this
That's
idea,
true.
this concept, right?
Hmm.
Yes. Kelly, what do you want birth professionals in general to know from a labor nurse perspective?
Mm,
Like
yeah, that's a good one.
how can we best support our clients either in pregnancy or in the aftermath of birth.
Yeah.
What would best support you in your work in that hospital and in that labor room?
Well, the biggest gap that I noticed first and foremost was the lack of emotional preparation. Um, so that's why I started doing the birth coaching. That's why I started the podcast, because I think that being able to have that mindset flexibility when you're in the birth process is super important, and running from the things that scare you and avoiding thinking about them rather than processing it and figuring out why those things are coming up for you, why that negativity is coming up for you, is doing moms a disservice. I think that what we need to do is work through all of those feelings and possibly past trauma, um,
Yeah.
because running from it before you get there isn't going to prevent it from coming up in the labor room. What's going to happen is you're going to be in the most vulnerable state of your life, and you're going to need to be the most emotionally healthy that you can be in order to let your body and your physiology relax and do all of the things. And so if you are constantly triggered, or if you're constantly feeling like you need to protect yourself, if you feel defensive, if you feel like your um, you know, your fight or flight mechanisms are reacting, if you're in a state where adrenaline is being released and cortisol is being released, you're gonna have a very dysfunctional labor. And so having someone support you through that, whether it's a doula, whether it's a birth coach, whether it's a therapist, ideally, if you need all of them, then you would have all of them.
Yes.
That is super important. And if you're having a hospital birth, more than likely, you're not going to have as much time with your provider as you would like to be able to have the responses to all your questions answered in a satisfactory way, because there's not a lot of time allotted for providers through insurance. And there's never a shortage of people having babies. And let's just say that physicians' hours in obstetrics are less than satisfactory. And the way that they have to work almost 24/7 makes it so that not a lot of people are wanting to necessarily go in there. And so there's maybe a shortage of physicians, and they're in there just working their tails off and cannot give you the attention that they want to give you and that you deserve. And so I recommend people find professionals that can help them through that process, that can help them streamline their questions and their desires and understanding and learning of the birth process and what it means for them, so that they can go into the birth space emotionally prepared with the idea that they will be able to have the right responses for them and their baby in the moment while they can still be vulnerable. The
Yeah.
other thing that I think is important for, let's say, support people, if you are planning on supporting someone in a hospital setting, it is important that you are comfortable in a hospital setting. Um, the worst dynamic that I've seen is when we have a birth support person that is trying to fight the hospital system, whether it's the
Mm.
doctor or just the system in general, hospital policies. As a labor nurse, I can walk into work and not necessarily agree with the hospital policy, but I'm not going to walk into the labor room and use that as my platform to initiate change. What I am going to do is I'm going to support that parent that is birthing in the best way that I can, given the resources that I have. And then later, if something didn't work out, I'm going to bring it to the attention of my fellow nurses and the administration and see if there's something that we can do to slowly change, because change is slow in the hospital setting, because it requires evidence, it requires studies, it requires proof that it is the best way to go. And what you don't want in your birth is for the professional that you hired, that you trusted, that you bonded with, to be an adversary to the people that are in the hospital with the resources that are able to help you birth. You don't want that fighting, because it's super awkward to be that person in the middle. And I guarantee you that vulnerability that you need when you are in the birth space is not going to be available to you if you have to be the intermediary between your birth worker and your medical team. So hiring somebody that understands and is on board with you and your hospital process and how to help you through that, how to work around the equipment, how to help you understand what the policies are in that hospital, so that you know going into it what your options are and what you can ask for. That is way more helpful than trying to fight the policies. And finding a provider that you align with in a hospital that you align with, if that's available to you, is hugely important.
Yeah.
Because you can't be vulnerable if you don't feel like you align with the people that are helping you.
Well, that's the hardest part
Yes.
in a hospital birth, is that you don't know who your doctor is going to be, if
Right.
he's ever on call. And
Yeah. And especially for moms that are birthing that aren't labor nurses, that don't get to, spend years interviewing the providers.
right, yeah. So you're at their mercy.
Yeah.
Yeah.
And sometimes you're going to have to make choices based on the resources you have. Like, for instance, if you have, let me just go back to my first birth, because I don't want to speak for anybody else. In my first birth, what was most important to me was going into natural labor. What I realized later was it might have been better for me to have an induction so that I could guarantee that my physician was on call. But also, going and having an induction doesn't necessarily mean that that's the person that's going to deliver you.
right.
So it's always a catch-22, right? So then having somebody that can work with the medical staff, ask the right questions, and slow the process long enough for your brain to keep up if it's not an emergency is imperative. And then understanding how to have that communication with your own medical staff so that you can also advocate for yourself is even better. So that's where preparation comes in.
Mm-hmm.
You can work around some of the limitations of the hospital providers and the hospital policies if you've learned how to communicate with the hospital in a way that they understand. So one thing that I feel like that I teach in my coaching program is something that we all learn in the hospital, which is our cuss words. So it's CUS.
Okay, got it. Yeah.
So for instance, if things are just not starting to not feel right, you can say, I'm concerned. Nobody's going to be offended if you say, I'm concerned. Boy, I'm concerned. I keep hearing this heartbeat going down. Is everything okay? If they say, yes, everything is fine. Sometimes the heart rate goes down, it fluctuates. What you're not noticing is it's going up beforehand. Those are called accelerations. That's great. We love that, right?
Yeah.
Or I'm concerned. You want to start Pitocin, but I don't feel like I've been in labor long enough. Like, can I try a little bit more? What can we do? What are our options? They respond and it doesn't work quite. It doesn't sit well with you. I'm a little uncomfortable with that position or with that recommendation. Do you mind if we wait a little bit so I can kind of think it over, consider my options, kind of like 30 minutes to kind of think about it? And then if you're being pressed and you're not feeling comfortable, you can say a couple of things. So the third S is safety. What the nurses are trained to do is say, I'm concerned, I'm uncomfortable, this is a safety issue. But the way I turn it with patients or clients is I say, am I safe? Is my baby safe? That helps us understand if this is an imminent emergency or if you're just being pressured because whatever reason the doctor has. And when you use those words, what I notice is that people's guard goes down. If you're pushing someone and they start saying those words, then you realize that maybe you've pushed too hard and you back it up. Because it's really hard to say, am I safe? To say, no, your baby is not safe right now, or no, you're not safe right now. If that's not the truth, it's really hard to tell somebody that.
Got it.
Yes.
Yeah.
Like if you're trying to manipulate, and not that I'm saying that doctors try to manipulate, but if you're trying to get the situation into the picture that you want, right? or your comfort zone. Let's just call it your comfort zone, because providers have a comfort zone because of the trauma that they've seen and the situations that they've seen, and they're trying to prevent that. Okay. And whether or not it's good to operate on in a state of fear isn't, we're not here to discuss that.
Reality.
But that's how we operate. If we say, am I safe or is my baby safe? That requires, I mean, how can you not look at what's going on and say, oh yeah, you have to take a step back and think about that. And so along with the brain model, which most doulas will teach, the benefits, risks, alternatives, intuition, and nothing, like doing nothing.
Right.
Those are questions to ask, but also the communication strategy of using your cuss words to bring someone down to a level that where we can all just kind of calmly talk, I think is really super helpful. And so if you're able to do that, I feel like with any human being, you're going to have a better experience, and you're able to get to a point where everybody is comfortable moving forward with a plan that we all have decided is the appropriate plan.
Yeah. Kelly, one of the things that I know about birth is that moms are meant to
Mm-hmm.
be in their reptilian brain. They're not meant to be
Mm-hmm.
thinking as they're going through this birthing process. And so,
Mm-hmm.
do you notice a difference when mom's in her space and doing her thing, and then something comes up and they have to like process and think? And
Mm-hmm.
are they able to go back into that? Or, I try to tell my moms, it's like, get a doula, get your partner on board so they do the thinking for you. And
Yes.
you're able to just stay in the reptilian part of your brain, which knows how to get this
Mm-hmm.
on out. What's your
Yeah. And if you are going right along in labor and everything is fine, that's perfect.
right? Okay.
If you have if you're there and you've been on magnesium because you have preeclampsia and you have all these medical issues where you're going to have to make some pretty hard medical decisions, yes, it's really hard to not be in your reptilian brain because you have a lot of things going on with you. That's why the acronyms are helpful. And
Yeah.
I tell my clients to like put them in their phone so that they can just pull them up when they start to feel uncomfortable, when they start to maybe not align with the things that they're saying, or if fear creeps up.
Yeah.
You can just remember all of these things that you can ask. Like, I'm concerned about what you just told me. What are the benefits of this procedure you're
Right.
recommending? What are the risks? Well, I still feel uncomfortable. What are the alternatives? My intuition is telling me that this isn't quite right. Am I safe? Is my baby safe? Well, okay, so what are the risks of doing nothing? If you just go through that,
Yeah.
you don't even have to think.
Right.
That
Right.
does the thinking for you without you having to like, because if you're in your reptilian brain, your rational communication is not there. And so you can quickly pivot to the answer that you want if you go through that whole process.
Yeah.
And yes, I would 100% love to have the option of having a doula, a support person with you. And also, is it truly autonomy if you're not the one making the decision? Now, granted, you have made the decision ahead of time and told them, but sometimes things come up for you during labor that are nuanced and change that. So I kind of want to provide moms with the option to like kind of short circuit that that going back to your non-reptilian brain so that you can kind of
Yeah.
just peek out for a moment and be like, here are all my questions, and then pop right back in because you've had it answered, right?
Yeah.
You're you get it answered in a way that makes you still feel safe. So if you go back to safety, then you can go back to your reptilian brain. You have to be in safety to be on your reptilian brain, because otherwise you're in fight or flight and you're just running away.
Yeah. Yeah. So cool. Oh my gosh, this has been incredible. Any last tidbit, golden nugget that you want to get in before we say goodbye?
Oh, just prep, prep, prep. Go to your pelvic floor physical therapist and get some pre-work. Go to your chiropractor. Find somebody that can get you connected with the resources you're going to need before and after. I'm
Yes.
happy to be that person. Birth coaches and often doulas are trained for that. Have a therapist. Boy, this is going to be the biggest change of your life. Give yourself the gift of therapy.
And
And find the provider that you align with and make sure that you get all of your questions asked. And if you can't find somebody that can help you, streamline those questions so that you can feel comfortable going into labor.
Awesome. And I hope everybody listening in, if you're a provider, you can take this information and share it with your clients to help them get the resources that they need. And hopefully, as providers, you might have a list of those resources to give to your clients so that they don't have to start from scratch. So thank
Yeah.
you so much for this. It's so interesting. I love teaching the courses that I teach are interdisciplinary. So they're
Mhm.
chiropractors and midwives and PTs and
Mhm.
OTs. And I love the different knowledge base that people bring to my life courses. And so I so appreciate having your labor nurse perspective and your
Mhm.
experience so that sharing that with us so that we can have a greater understanding of how to best support our clients that are choosing to birth in the hospitals. And so thank you so much for that. I also want to put a shout out for those the sacral flexion that we talked about and what Kelly was noticing in her mamas that their butt changes after birth. I have a free sacral flexion course. Please check that out if you haven't already. It's meant for practitioners to know what to do on how to treat that. So please take a look at that. And Kelly will get all your links. Kelly, how can people best find you?
KellyHof.com. It's KELLYHOF as in Frank.com. All
Awesome.
of my stuff is there.
Okay, great. We will put that in the show notes as well. So thank you everybody so much for listening in. Thank you, Kelly, for being here and sharing your wisdom with us. And here is to smoother births and faster recoveries. We'll see y'all in the next episode, everybody. Bye-bye. Today's podcast was brought to you by the Institute for Birth Healing. To discover more, visit instituteforbirthhealing.com. To claim $50 off of any online course, use coupon code podcast50 at checkout. Till next time, I'm Lynn Schulte, founder of the Institute for Birth Healing.